Welcome to Costa Rica. My name is Johnny from Johnny Knows Costa Rica. Today, you know what? We got the pleasure of meeting with an anesthesiologist for that comfort when you're doing an all-in-4 or if the procedure's a little bit longer. But we're going to find out what's the magic behind that anesthesiologist. But sometimes not everybody's used to this, but here in Costa Rica, it's very common. But you know what? We're going to talk with the doctor. Give me a second. We'll be right back. Well, Doc, tell us a little bit about what is anesthesia. You know what? It's like a myth here in Costa Rica, but it's with the equipment that I saw with you, with you know what, that oxygen, all these things. Why is it important when you're doing a dental procedure?
Okay, first of all, in odontology, we used to do some sedation for some procedures like dental implants, or when patients are very anxiety or it's very phobic. So we gave the patient some drugs to be relaxed, to stay still, to stay calm, and to get a little bit sleepy during the procedure.
Well, today we had a patient, and how was that experience? What made it different?
Okay, the difference is the patient can stay still, can stay relaxed, and can tolerate the lengthy procedures. For example, our patient today, she was under sedation for 3 hours, and she can tolerate the procedure.
Okay, and then you know there was some oxygen there. What's the oxygen for?
Okay, for all these procedures, when we use sedation, it is important to use the oxygen while the patient is under sedation. So he or she can breathe high concentrations of oxygen to avoid some situations that can be dangerous during for the procedure.
And the complications that could happen with that, what are they?
Okay, one of the complications could be the obstruction of the airways. So we need to be aware of that. How we can do that? With our monitors. We need to monitor to see blood pressure, to see ECG, to see the oxygen in your blood, and your respiration all the time during the procedure.
But Doc, you've been doing this for 12 years, and it's always the same way?
Yes, it's always the same way.
You take all these precautions. I see a lot of monitors there. There was different areas that you were monitoring, correct? There were different items that you were monitoring? You're monitoring different things?
Yes, we are monitoring different things. In our monitoring, we can see all the vital signs, and we can see almost the electroencephalographic waves too.
Well, Doc, thank you for taking the time to explain what this anesthesia, because not everybody does it, right? But it's something very important. Well, thanks for taking the time. Thank you, sir.
You're welcome.